But let's begin with this nasal inhaled version of remdesivir, which I know is an area of interest to you as a pulmonologist because you yourself have been looking at another drug called Xclear, which is an antihistamine and antiviral, and you intend to present it to the FDA for a trial later this week. Why is inhalants such a potentially potent approach?
It's an excellent approach, and the reason is that research has shown that the viral infections occur predominantly in the nose and then trickles down into the lungs. Recently, Chapel Hill from North Carolina, they published a study where they mapped the infection, and they found that the largest number of replication of the virus happens in the nose. And this is not new. Research from China has shown exactly the same thing, and we have a lot of interest in that area.
Yeah, so you're going to apply for an FDA trial to see how Xclear works as a combatant to the coronavirus, right? Have you got any ideas that it may work?
It does. We actually performed studies at Utah State University, and then we did it at Geneva University, where we study the virucidal, the capacity of killing the virus. And within 15 to 20 minutes, our nasal spray was capable of killing more than 90% of the viral load.
Let's talk a little bit about what you're seeing in and around Florida. You work down there in the North Miami area, Aventura, Plantation General as well. Are people wearing masks? And if not, who's not?
That is an excellent question. Yes, I think, unfortunately, we have relaxed way too much in terms of following the guidelines and using masks. And we see this predominantly in the young population. After Labor Day weekend, we saw a massive amount of people going to beaches and outdoor places, but they were really in close contact, no using, social distancing measure, no using the mask. And the mask is important. We know that the virus replicates significantly in the nose, and then it will trickle down. So the use of the mask will help us also prevent mechanically the transmission of the infection.
Masks, bottom line, masks work, right?
They do, absolutely.
Let's talk a little bit about the point you just made there, which is that it seems like it's more younger people who are maybe less prone to really serious health effects of this disease, but there are plenty of young people who have succumbed to it and gotten really sick with it. But older people seem to be a little bit more respectful, I hear you say. One of the areas where the disease has been extraordinarily rampant has been nursing homes. There have been tremendous death in those places. What are we learning about how we manage infectious disease in the nursing home setting that we didn't know before? And what changes need to be made so that those places can be made safer for the elderly?
I think at the early peak of the infectious process, the pandemic taught us a lot. And I think nursing homes continue to learn, just like our hospitals are learning how to handle the volume of patients that we see. But as you said, we're seeing more young people than all the population. I think they are very cautious about all the social measures, distance and measurements that we have and we follow. But younger population, not so much. But remember, young people will get in touch with the elders and they will pass on the virus. So I think it's an important measure that everybody should follow.
What about the level of the patient load in the hospitals where you work? What is it like in the ICUs? Are the case counts rising? How close are you to capacity? How concerned are you that you may have to bring in sort of tent hospitals and tent ICUs and so forth?
I think we can manage as it is today, but we definitely see a significant increase in the number of cases. 3 weeks ago, we didn't have that many cases in our ICUs or in the regular floors in the hospital. Today, we're reaching close to capacity in our ICUs, predominantly in an area of Plantation, where we have a large number of patients there diagnosed daily with COVID. I think we learned from the Plantation, from the initial outbreak, how to handle and triage patients, but definitely we need support, and we definitely have learned how to handle those things. We have an incredible support from the administration of the hospitals. People have learned how to allocate resources for the peak and for whatever is coming.